So what if people have teeth that are so bad you can't save them, and they want a brand new set of teeth supported by dental implants? What's that process like?
So we treat these patients day in, time and time again. This is the bread and butter of our practice.
Okay.
And oftentimes a patient will come in with teeth that aren't savable, or that the patient doesn't want to save. And we're able to extract those teeth that are diseased, clean up that disease, get them in a healthier state first and foremost, alleviate the pain, and then make them a brand new set of teeth that when someone else is looking at them, you can't even tell that they're artificial. Right, so here are their options for the patients that need a full mouth of extractions. We can make them a traditional denture, upper and lower, and restore their smile. We could get them traditional dentures with help of dental implants that they snap in and snap out so that they're more stable.
Okay.
Or we can provide a more permanent solution and give them a set of teeth that don't snap in and snap out, rather they're fixated to their mouths, mimicking what they're used to all their life.
At about half the cost of the so-called leaders in this industry.
Correct.
Is that fair to say?
It's
more than half off.
It's more than half off, and that's the icing on the cake, is that we're able to provide this service at an incredibly cost-effective way.
You know, I'm not trying to side with you on this interview, but you know, we're taping here in San Diego, where we broadcast out of, and Mexico is right an hour and a half from us, and people go and get their dentures in Mexico. And I know your prices.
We hear it all the time.
And their prices, and you're even less than those guys.
Absolutely, 100%. We hear about that all the time, and you know, patients will fly to South America, or they'll get work done in Europe, which is all well and good. It's just, what happens then if there's a problem, right? Or what happens then if we don't have the parts to fix it because they used other types of parts? So the fact that we're able to do it all under one roof, and the same doctor that's providing the surgery is the same doctor that's providing the teeth, it really, really translates into a very, very efficient, cost-effective, and comfortable way of doing it.
So no more old-fashioned dentures. Because even if you pick the denture option at your centers, these are a better fitting, better looking denture that you're digitally making on a computer.
Absolutely.
Is that right?
With the state-of-the-art technology that we're using, scanning things digitally, 3D printing, milling, the level of detail that we're able to reproduce it's unprecedented, and it's changing our profession. And I'm excited, and I'm humbled, and I'm proud that we're able to provide such a high level of service to patients that would have not necessarily been able to do so at the dentist across the street or at a neighboring office. It's incredible.